who died tend to be released from jail with no interventions, or they were held up to 72 hours in their local mental health institution, and they had no addiction or mental health treatment follow-up afterwards. Had there been more support for these folks, there's a good chance that they would have still been alive at that 26-year mark. Suicide is both preventable and often temporary phenomenon, and those who attempt would benefit from both lethal means restriction and follow-up treatment. Any questions about that? No? Good? Okay. Suicide risk factors. I want people to recognize, especially when the suicide risk factors and the warning signs, again, just how many of them are so similar to the consequences of late-stage addiction and middle-stage addiction. Risk factors are dynamics that tend to be present in those who attempt or complete suicide. Prior suicide attempt is the most potent factor. It's likely that the method will continue to get more and more lethal the more attempts a person makes, but it's also important to note that about half of all suicide deaths were the person's first attempt. We've already talked in great deal about why chemical dependency is a risk factor, and I will talk in greater detail about this a little bit later during the warning sign section. But what I would like to note is that a person does not have to be addicted for their substance use to be problematic. All right? Individuals who use, misuse, or abuse substances can be negatively impacted by substance use and can be disinhibited by alcohol and drug use. They can overdose without ever having this disease, and any use, especially with other risk factors present, can be deadly combination. New statistics coming out of the Substance Abuse and Mental Health Service Administration concluded that 1 out of every 11 illicit substance users, 1 out of every 11, struggle with suicide in the last year. Individuals with a diagnosed mental health disorder are much more likely to have a substance use disorder. According to the National Institute in Mental Health, if you have OCD, you are 3.5 times more likely to have a substance use disorder. If you have depression, you are 4 times more likely. Schizophrenia, you are 10 times more likely. With bipolar disorder, you are 14 times more likely to develop a substance use disorder. And with antisocial personality disorder, you are 15 times more likely to become dependent on substances at some point in time in your life. Alone, these disorders are a risk factor for suicide. Together, they are very lethal. History of child abuse or recent trauma. Oftentimes, the culture of addiction is one big, long, traumatic nightmare. I have counseled many people who have been raped, stabbed, shot, or been present when a using partner or best friend dies of an overdose. It is important to note the confluence here between trauma and addiction, and not only is a history of trauma a risk factor for suicide, but there's